Welcome to the side event at the 11th Multi-Stakeholder Forum on Science, Technology, and Innovation for the Sustainable Development Goals. I'm Vilda Sugtas. It's my pleasure to co-moderate the event today alongside a wonderful colleague, Colleen Rollins. So it's my honor to introduce her. She holds a PhD in psychiatry from the University of Cambridge, where she was a Gates Cambridge Scholar, and a BSc Neuroscience from McGill University. She has a diverse background in mental health research in both academia and industry, and she's currently an editorial and project manager at Climate Junction, and she's passionate about the intersection of climate change, mental health, and human psychology and behavior. Colleen, the floor is yours, and welcome everyone once more.
Thank you, Vilden, for the introduction, and most importantly, for convening all of us here today. It's really a special moment to have such a wonderful group of speakers and a curious audience all in one place. So my name is Colleen Rollins, and it's my pleasure to introduce Vilden in turn. She's the founder of Youth for Planetary Health, which is a nonprofit based in Germany dedicated to spreading awareness of planetary health among young people worldwide, and a member of the Planetary Health Alliance. Vilden is a project coordinator and membership of the leadership team at Climate Junction, which is an initiative of the Climate Psychiatry Alliance. And she leads the podcast called Mind the Planet on climate mental health. She is active in the Neuroclimate Working Group and the American Public Health Association, and she currently leads an international research project measuring eco-anxiety among young women in the Global South, beginning in Indonesia and Turkey.
Thank you so much, Colleen, and we're delighted to kick off this event with the opening speech of our co-host, Dr. Joshua Wartzel. So as an introduction, Dr. Wartzel is an attending psychiatrist and adjunct assistant professor in the Department of Psychiatry at Yale University. He's a nationally recognized expert in climate mental health, and he's the founding director of the Heat Mind Lab at the Institute of Living at Hartford Healthcare. And his research has been supported by grants from the National Institute of Mental Health, and Wellcome Trust, among others. He serves as co-chair of the AACP Committee on Climate Mental Health. He's a member of the Group for the Advancement of Psychiatry Climate Committee, and he's a scholar of extreme weather events and counter-adaptation of the National Institutes of Health. Dr. Wartzel, you have the floor.
Thank you so much for the introduction. It's genuinely an honor to be here with you all today and to be in conversation with such incredible experts and distinguished colleagues, both on the science side as the policy side. This topic really deserves far more attention than it currently gets, so I'm excited that we have this venue. So as we're all very well aware, the realities of climate change are upon us. Summer temperatures have already risen, some would say, by 1.5 degrees Celsius on average. And projections suggest that this could climb by 4 to 6 degrees by above our pre-industrial levels by the end of the century. The physical consequences, things like heat illness, respiratory illness, cardiovascular events, are increasingly part of our global conversation. But today we're going to discuss an aspect of climate on mental health that I think gets far less press and attention. Climate change is already a mental health crisis. It seems particularly a crisis for children and young people, which we can talk a little bit about later. My colleagues and I have demonstrated this with data. We have seen that suicide rates, homicide and crime rates, and mental health hospitalization rates all rise during heat waves and more broadly across the summer months. We see this pattern across decades and across countries. In my own lab, sorry, allergies are affecting my throat. We are able to speak on this a little bit later specifically, but we've actually been studying how young people appear especially vulnerable to heat-driven mental health effects. Heat is only part of the picture. We know that air pollution is impacting cognitive development, depression, dementia. Insect-borne diseases are spreading to new places and people and causing psychiatric sequelae. Climate-related disasters like wildfires, hurricanes, floods are destroying the homes of communities and leaving psychological trauma in their wake. And millions of people, particularly young people, are now carrying a chronic, invisible, existential weight that we call eco-anxiety or climate distress. And this is experiencing the grief of watching the world that they were promised change around them, seem to disappear. These are only examples scratching the surface of the myriad ways that changing climates are affecting mental health. This is an emerging field called climate psychiatry. It's vast, it's under-resourced, and it demands our collective attention. These effects are not theoretical. They are already having impacts on the quality of lives of people across the world and are contributing to higher rates of suicide, particularly among young people. So we need policy and framework for how to make urban design changes that take these changes seriously to our climate. We need to sustainably invest in research to deepen our understanding of how climate is affecting mental health and to develop interventions that are clinically meaningful, cost-effective, and scalable. So with that, I just want to thank you again for being here, and I look forward to the conversation ahead.
Thank you so much, Dr. Wurtzel, for this really full-bodied overview of the breadth and depth of this emerging field that we're calling climate mental health. Next, we're honored to hear the opening remarks of Dr. Maria Neira. Dr. Neira is a physician and one of the world's foremost voices on environmental health. She spent 2 decades as director of the Department of Environment, Climate Change, and Health at the World Health Organization, shaping global health policy at the highest level. Between 2002 and 2005, she was Vice Minister of Health and Consumer Affairs in Spain and President of the Spanish Food Safety and Nutrition Agency. Her first assignment in the WHO was as coordinator of the Global Task Force on Cholera Control, and after this, she was appointed as director of the Department of Control, Prevention, and Eradication. And before joining WHO, she obtained extensive field experience working for years in Africa as public health advisor in the Ministry of Public Health in Mozambique and in Rwanda, where she served as UN Public Health Advisor and physician for the United Nations Development Program. Dr. Neira, please take it away.
Dr. Nair, I believe you're on mute.
Now, okay. Thank you very much, and it's really a great pleasure to see you all, to maintain the motivation, to realize that you are all very much committed, because this is something extremely serious and will require very much the voice of the health community. Otherwise, the speed on which we are reacting to climate change and pollution is definitely not the one that we need due to the magnitude of the problem we are facing. On my remarks, I want just to share with you some quick experience from many years in WHO and how we were able to move this agenda of climate change and health, and making sure that everybody will realize, and this was our first priority number 1, climate crisis is a health crisis. It was not an easy one, as you can imagine, when we were saying that we put all the evidence on the table, and still you have, even among the health professionals, a lot of reluctance to understand that this is not in competition with infectious diseases or with fighting against non-communicable diseases. At the contrary, it's something that is undermining all we have been achieving in public health. And if we do not address the causes of climate change, we will still keep missing 7 million people every year, having chronic diseases, having infectious diseases, having massive displacement, and of course, the impact on our mental health as well. So it took us a certain time to go to COPs, try to infiltrate our message, and making sure that people will realize that they were negotiating about emissions at the COPs, fine, but anytime they were negotiating about the percentage of emissions they wanted to reduce, and they were never very ambitious, to be honest with you, they were negotiating with our health as well. So we started as well to bring lungs to the COPs to explain everybody that our health was already paying the price of lack of actions at the different COPs. So climate crisis is a health crisis. Then we moved to say health is already paying the price. Then we started to say there are health benefits of climate action. And then our latest report was on saying health is the argument for climate action. So health can be a very, very strong motivation, a positive one, because I think our population wants to hear us talking with a very positive and engaging message. And then we started to say any action you take to fight the causes of climate change is you are fighting at the same time the causes of air pollution, and you are generating millions of health benefits and saving millions of lives from a healthy transition to renewable energy, from a healthy transition to sustainable food systems, and from a healthy urban planning. So all of these transitions will generate enormous health benefits, health outcomes. So we want people to understand that, because we think that this will be the way to move. Now, on mental health, we started to work on that a few years ago as well. And again, a lot of reluctance, difficult to connect. People have difficulties to understand. But again, it's not just the climate change causing a lot of negative impact on our mental health, it's as well air pollution that is responsible for massive problems on our neurodevelopment. And we are now accumulating more and more evidence on that. And it's as well, again, the positive argument. If you accelerate, if you scale up your agenda on tackling the causes of climate change, the health benefits, including those of mental health, if you create cities, if you have urban spaces where you have green areas, if you can have more social interaction in your cities, your mental health will benefit no matter what. So we were focusing again on the fantastic and big health benefits that can be obtained. And then I think you need to concentrate on those positive and maybe taking over on this agenda of climate change as the health community, because this is the only way to speed up and respond to this massive crisis that is causing such an incredible damage for all of us. Don't forget that the health system can contribute as well. We can reduce our carbon footprint dramatically, and we need you, the youth, to accelerate this agenda, to maintain a positive approach to that, to explain to your generation that this is not just about being very much concerned, but it's about taking action, and that action will be beneficial for the economy, the sustainability, and of course, for human health and the mental health of our people. So I wish you really keeping working very high on this agenda. Don't accept any excuses by anyone, including because of the current geopolitical situation now. Everybody will have fantastic excuses to postpone action, because this is very much linked to the crisis we are facing today, the energy crisis. If we were accelerating that transition to sustainable sources of energy, not only our health will benefit, but maybe the reasons for political conflicts will decrease as well. So thank you very much for the invitation. I will stop here.
Thank you so much, Dr. Nera, for your perspective and lived experience on how this critical intersection of climate and health has been brought together. And of course, for all of the years of your own work that you've done in connecting these dots. We'll now be launching into our panel discussion. This discussion will have 2 rounds of questions with 4 minutes for each question. So in round 1, each of our 5 panelists will respond to 1 question. And in round 2, we will have 3 panelists who will receive a second question each.
So we're honored to start off the first round of questions with Ms. Tony Shea Freckleton. So Ms. Freckleton is a senior international development professional currently serving as the director of the United Nations Human Settlements Program New York Liaison Office, advancing priorities on sustainable urbanization, among other topics. And previously, she served as chief of the New York Liaison Office for the United Nations Office for Disaster Risk Reduction. She specializes in disaster risk reduction, climate resilience, and sustainable development. So Ms. Freckleton Shackleton, our question to you is, planetary crises, including climate change, are generating compounding risks that disproportionately affect vulnerable communities. And as extreme heat, flooding, and displacement reshape cities at an unprecedented pace, how do you see these pressures threatening or redefining the future of urbanization, particularly through the lens of mind and brain health?
Thank you very much, and it really is a pleasure for me to join the conversation this morning, and congratulations to the organizers, because this is truly a timely and important conversation. So based on the question you've posed, let me begin by putting a human story at the face of this. So imagine a mother living in an informal settlement on the edge of a growing city, and her home traps heat during the day. At nights, she listens for rain, knowing flooding could come without warning, and her child struggles to sleep, misses school, and when it's too hot, it becomes anxious every time dark clouds gather. So this is not just a housing issue. We see that this is a mental health issue and a brain issue. And it is really the lived experience of climate urbanization and many of our peoples living in urban centers. Planetary crises are not only reshaping cities physically, they are also reshaping how people think, how people feel, and how they cope. Now, the climate impacts are already directly affecting mental health in cities worldwide, as we heard in the opening remarks. We are seeing rising levels of stress, anxiety, and trauma linked not only to extreme events like floods and heat waves, but also in anticipation of worsening conditions. And I can also share the experience of many children in Jamaica who now, after the impact of Hurricane Melissa, are totally traumatic when they are to experience weather events, one, and two, as we are 1 month away from the next hurricane season. Now, repeated exposure to heat, air pollution, and flooding creates cumulative psychological strain, especially in already vulnerable communities. So urbanization is accelerating this exposure. With over 2 billion people living in cities, and that number, as we know, is expected to grow fastest in many regions already facing climate vulnerability. The greatest risks are those concentrated in informal settlements, in coastal cities, small island states, and those rapidly urbanizing regions in Africa and in Asia. But what is missing increasingly is how we talk about this mental burden. For young people in particular, they are experiencing these rising levels of climate anxiety in many cities, layered on top of unemployment, housing insecurity, social inequality. And when the future itself feels unstable, it's directly impacting their motivation, their learning, and their long-term well-being. Just to add the impact on a few more, groups of the societies, when we talk about indigenous communities and others who are displaced or forced to migrate into urban areas, the loss is not only about physical land, it's about their identity, their culture, and their belonging. And that disruption also carries profound psychological consequences. So the question becomes, what kind of urban future are we building? If these trends continue, we really risk creating cities that amplify stress, isolation, inequality. And, this is something that must be addressed. Now, when we look at urban planning and design, these can actively support mental well-being while building climate and disaster resilience. As we heard, access to green spaces, it's linked to reducing stress, improving cognitive functioning, while also cooling cities and improving air quality. So this is where, among other things, this is where the new urban agenda and the platforms like the World Urban Platform that is coming up in another 2 weeks in Azerbaijan, where they are critical. They really emphasize how sustainable urbanization, it must be inclusive, it must be resilient, and it must be people-centered. And we need to go further. explicitly recognizing that resilience must include mental resilience. So I say all of that to close by saying, planetary crises are not only testing infrastructure, they are testing our ability to protect human dignity, identity, and well-being. And when we talk about the future of urbanization, it will depend on whether we design cities that reduce stress and restore a sense of control. So I'll leave it there and hand it back to you, Vildan.
Thank you so much, Mrs. Freckleton, for these really vivid descriptions and stories of some of these real-world impacts of climate change and urbanization on everyone's well-being. Thank you so much. Now I'd like to introduce our next panelist, Layla McCurdy. Ms. McCurdy is the founder and chair of the American Public Health Association's Children's Environmental Health Committee. She also chairs the Climate for Health Executive Committee at ECO America, and she serves on the boards of Children's Environmental Health Network and the Neuroclimate Working Group. She has over 20 years of experience in public health and the environment and has been instrumental in creating thousands of environmental health champions among pediatricians and other health professionals, and also in developing environmental health interventions which have been successfully implemented in many communities. She has organized conferences, led public education campaigns, developed tools and resources, published in peer-reviewed journals, and has served on governmental and non-governmental committees. So Ms. McCurdy, our question to you is this. Children are clearly not just small adults. Their brains and minds are still developing, which makes them uniquely vulnerable to the compounding stressors of climate change, air pollution, extreme heat, and displacement. Yet these mental and neurological dimensions of children's environmental health has been largely neglected from research and especially from policy. From the perspective of current science, what do we now know about how planetary crises are shaping children's mental health and brain development? And what are the most critical next steps that we can take to integrate that current science into decision-making?
Thank you, Colleen, and Vildan, and everyone that contributed to the planning of this really very timely, I guess, strategic planning gathering. And thank you, everyone who took the time to join this webinar. Of course, as Colleen indicated, climate change is a major threat to children's health and well-being, with negative effects extending far beyond environmental concerns to encompass physical, mental, neurological, and developmental consequences that can persist throughout their lives. All children are vulnerable, but children from marginalized communities are even more vulnerable due to existing inequities, which was summarized really well by the previous speaker. Thank you so much for doing that. In comparison to adults, children are uniquely vulnerable due to physical, physiological, and behavioral differences. Their developing bodies, higher metabolic rates, and faster breathing rates increase susceptibility to environmental hazards, while critical windows of brain and organ development make them particularly vulnerable to long-term effects of climate change-related exposures. These vulnerabilities compound with intensifying climate impacts to create physical health effects, as well as mental health impacts on their cognitive function, neurological development, emotional regulation, and overall mental well-being across the lifespan. The convergence of children's unique vulnerabilities with climate change presents a public health issue that urges immediate coordinated action across healthcare, public health, education, and policy sectors. I believe we have sufficient scientific evidence based on the mounting research in this area to activate national and local partnerships that can tackle this issue. But first, we need to create evidence-based tools and resources by translating science and by developing messaging that are appropriate for each of the stakeholders in order to empower them to take action to integrate mental and brain health into decision-making. The organizations I'm affiliated with, including APHA, Neuroclimate Working Group, Children's Environmental Health Network, Climate for Health, and others, use this approach. And we participate in partnerships with other groups as appropriate. For example, recently, several national public health and education groups came together, and we created the Network for Resilient Schools, which is led by the American Psychological Association. We developed a health advisory on extreme heat for schools, which has a strong mental and brain health focus. It will be released soon, and we plan to share it widely. Since now our time is limited, I will not be able to get into the details of the various other resources that are available. I encourage you to explore the links I dropped in the chat and use the resources that may be helpful for your efforts. Thank you.
Thank you so much, Ms. McCurdy, for outlining the mental health risks and brain health risks of environmental crises and the special vulnerability of children. And thank you for those links that you dropped in the chat. And I'd now like to introduce our next panelist, Professor Imayadi. Professor Ayadi is a founder and president of the Euro-Mediterranean Economists Association, a Barcelona-based regional think tank that serves as a leading, independent, and innovative policy research institution. She's also co-founder of the Brain Capital Alliance, founding advisor to the Global Brain Economy Initiative, founder and director of the Euro-Mediterranean and African Network for Economic Studies, professor at the Bayes Business School, and senior advisor at the Center for European Policy Studies. She served as chair of the European Banking Authority Banking Stakeholders Group, of which she acted as elected chair from February 2019 to July 2024. And she's also an economist and international academic expert on international business and financial systems, financial markets and institutions, global financial regulation and governance, and socioeconomic development and foresight in economies in transition. And she's currently a member of several international high-level academic and advisory committees and editing boards. So, Professor Ayadi, our question to you is, could you help us understand what we mean by brain economy and brain capital and how these concepts connect to our environment and to the future of our cities and communities? And how does a degraded planetary environment directly threaten the brain capital that cities and economies depend on?
Good morning, everybody. Do you hear me? Thank you very much for inviting me, Vildan, and I'm very happy to share with you some of our latest work, in fact. So when we speak about brain economy, as you can see, this is a new concept that we've been working in collaboration, economists, neuroscientists, and other disciplines and policy experts. We are referring to an economic paradigm in which brain health and brain skills become together the primary drivers of productivity, resilience, and sustainable growth. So in reality, we are connecting two key fundamental pillars within a single model, which will allow us to take the human capital paradigm and index to a next level where brain health becomes an infrastructure rather than, a result. So brain capital is an asset based for it, as it combines brain health, which is practically our cognitive, emotional, and neurological well-being. Of course, we have measured it using the brain capital index, but then in this specific index, we are using a reduced definition, which is the absence of disorders, brain disorders within a given economy, and brain skills, which are in fact going beyond the normal skills, which are the technical skills that we already know that will lead us to educational attainment. But then we add into that the creativity, the adaptability, the problem solving, and the social intelligence. And also I would even further add the green skills that we really need to develop further to connect in reality the brain health in general and the environment. Now, in the 21st century, shaped by digital transformation, climate crisis, and the need to transit, in fact, to green and clean economies, and demographic change, also all these uncertainties that we are living in terms of the fragmentation, in terms of the geopolitical uncertainties and conflict that we are living in, all the capacities that we are developing within our brain become really essential for survival. So they are, in fact, core infrastructures for our economies and societies, and they are not completely separate from the construction. So they are not, again, a result. It's really an economic infrastructure. So how does this connect with the environment and our cities in general? Cities are where brain capital is both formed and deployed, but there are also environmental stressors that the previous speakers talked about. And these are all also concentrated at the city level and overall nowadays, because the event or environmental event and the shocks that we are seeing, climate shocks that we are seeing, they are becoming much more frequent. So urban populations also are increasingly exposed not as an extreme shock in an extreme shock scenario, but rather much more frequently to air pollution, extreme heat, chronic stress, and climate-related uncertainties. And all of these directly affect the cognitive function, the mental health, and the neurological development. We have the research, and I think this is all clearly reported, and it's publicly accessible nowadays. So in reality, this link is direct and is biological, and it's not abstract. We need to act upon it because, as the previous speaker said, the health crisis is a climate crisis. They are all connected. Both of them are connected. So a degraded planetary environment erodes brain capital. That is very clear through multiple pathways. And I say, first of all, the air pollutions that impairs cognitive performance and accelerates neurodegenerative risks. That's very clear. The heat stress reduces productivity, decision-making capacity, and emotional regulation. And this is also clearly reported in the literature. Climate anxiety and chronic stress reshaping mental health trajectory, and also especially among the youth. And this is essential nowadays. There are projects to deal with the climate anxiety, eco-anxiety, and all of these matters that we need to take them extremely seriously. And also because of the conflict there are displacements, and the displacement and instabilities that many regions, many countries are living today, in this planet. They disrupt education, social cohesion, and skill formation. And these are all create a toll on our cognitive capabilities and brain health in general. So in other words, environmental degradation is not only about an ecological crisis, it's a systemic shock to our human brain, and therefore has implications on our economies overall. And this, in fact, reframes how we think about cities. In a resilient city, it's not only about protecting infrastructure, it's the one that protects and enhances our cognitive and mental capabilities and its population. So it means it needs to be well designed in terms of the neuroarchitecture, in terms of the infrastructure to deal with those shocks, climate shocks that we are confronted to. And this is why we must move toward what we are calling the brain positive systems and brain positive urban systems, which are really designed to clean the air, green the space, and also reduce the sensory stress. But also we need to have the policies that integrate mental health, neuroscience and environmental planning within the construction of those policies, and investments, and a lot of investments that recognize that protecting the planet is inseparable from protecting our brain. So In reality, no healthy economy without healthy brains, and therefore no healthy brains on a degraded planet. Thank you.
Thank you so much, Professor Heidi, for explaining these important concepts of brain economy and brain capital. I think that a key theme from today is that our disciplines cannot remain siloed and that we need these interdisciplinary lines of work. I will now turn to our co-host, Dr. Joshua Wurtzel, with a panelist question. So Dr. Wurtzel, your research broadly explores how temperature affects mood and the neurobiological pathways behind that association. So could you tell us about how your lab is studying the neuroscience of youth vulnerability to heat and other climate stressors, and why city planners and policymakers should treat young people's brain health as an urban policy priority?
Certainly, thank you for that question. Let me start with what we know. Across all age groups, research is consistently showing a correlation between heat and suicide, as others today have talked about. In a national study that my lab conducted, we found something pretty striking. The effect of heat on suicide is twice as large in young people, young adults in particular, as in everyone else. So to put numbers to it, for every 1 degree Celsius increase above an area's average summer temperature, we see suicide rates across the general population rise by 1.5%, but in young adults, we see it rise by 3%. I want to put that number in context because that kind of sounds abstract. What does that really mean? After the 2008 financial crisis, suicide rates rose by roughly 5%. So just a 2-degree increase in summer heat would produce a comparable rise in youth suicide to what we saw after the worst economic collapse in most people's living memory. Many cities have already experienced a 3-degree rise, not 2, above their historical baselines. So we estimate currently that in the US alone, 100 additional young adults die by suicide each summer attributable to heat. And that's only the people who die. It doesn't count the people who contemplated suicide. It doesn't count the people who attempted and survived, and those whose depression has worsened during the summer, but without anyone connecting it to temperature. So the question then is, why is heat impacting mental health? We have some theories with some good data to back that up. Heat, we know, disrupts sleep, it impairs cognition, it reduces physical activity. Each of these has independently been shown to be a risk factor for worsening mental health. Heat in particular, as it relates to insomnia, is a concern because we know that if you're kept awake at night during your biological sleep time, that you are 5 times higher risk of dying by suicide when you're awake at night than during the day. So we have all of these suspects, but we're missing some clear studies that are able to connect the dots between how these mechanisms may be impacting mood, and not just that there are these abstract epidemiological, parallel associations. So that's one issue. The other issue is that we lack precise information about what temperatures people are actually being exposed to. So most research currently relies on outdoor weather stations, but as we know, most people are spending their time inside, where temperatures and humidity can be very radically different from outside. So that is what my lab is working on over the next 5 years. We're measuring temperature on people's bodies and in their bedrooms in real time. We're tracking their mood, their sleep, their cognition, and physical activity with wearable devices. And we're actually bringing some of them into our lab, which is a controlled sleep laboratory where we're able to heat things up and actually, study minutely the mechanisms that may be driving this heat-mood relationship. Once we understand how heat is hurting people, then we can start to act. So some interventions are, probably on the personalized level: cooling pillow, bedroom fan, medication adjustments to help the body cool at night, things of that ilk. We also need to understand broadly how our medications that we routinely prescribe are affecting the body's ability to cool. We know already that some likely make that worse. But I know the subject of today is the larger opportunity for systemic change. So building codes that require adequate ventilation, window shading, reflective roofing to reduce heat absorption, programs to distribute window air conditioners, and also even have insurance coverage for air conditioners that makes it so we can prescribe air conditioners to people with serious mental illness. We need to invest in 24-hour cooling centers for unhoused people during heat waves, not just something that closes at 5 p.m. and then leaves people exposed to the hottest temperatures, at night that affects their sleep, as we had just discussed. We already heard about green infrastructure. One of my favorite facts is that a park can actually be 7 degrees cooler than the surrounding urban landscape, just from the cooling properties of plants. So we need to think about how we increase our use of parks and rooftop gardens and green canopy throughout our cities. So the bottom line is that heat is measurably bad for mental health, particularly for young people. And we are actively doing the science to understand why, but we already have some evidence to suggest what we can do to translate science into policy, interventions that protect minds the same way that we try to protect, people from infectious diseases and, our lungs from pollution, et cetera. That translation is what this forum is all about. And so I'm so grateful that we have the space to do that today.
Thank you so much, Dr. Wortzel, for that description, both the really striking statistics and realities of youth mental health and heat, the fascinating insights that your lab is working towards, and then how we can translate the science, these discoveries, into policy. And I'd now like to introduce our next panelist, Dr. Lisa Van Susteren. Dr. Van Susteren is a general and forensic psychiatrist in Washington, D.C. She's an expert on the physical and mental health effects of climate disruption. She's also a clinical associate professor of psychiatry and behavioral sciences at George Washington University and co-founder of the Climate Psychiatry Alliance, an organization dedicated to promoting awareness and action on climate from a mental health perspective, including through initiatives like Climate Junction. She's also on the board of directors of the Climate Psychology Alliance of North America. Her book, Emotional Inflammation, was published in April 2020. Dr. Van Susteren, our question to you is, you are widely regarded as a founding voice for climate psychiatry, having sounded the alarm on the psychological impacts of planetary crises, including climate change, pollution, biodiversity loss, long before these connections were recognized by the mainstream medical community. And you've powerfully argued that this distress, this eco-anxiety, is reality-based and not pathological. So as cities face compounding crises, how do we build mental health systems that truly validate this suffering? And what has to change for these systems to finally catch up with what you've been telling us for nearly 2 decades?
Well, thank you very much, Vilden. I appreciate that introduction. And, I've got a whole stack of papers here that I could review and notes that I took to speak to this group. But I'm going to give a different perspective on the one that I had intended, because I don't need to tell all of you what the problem is. And how much information we need to get and have and all the rest. I'm going to take what is probably characteristic of me, and that is a little bit, it's not a contrarian view, but it's a parallel view, because our issue, I believe, is not that we don't have enough information. We got a lot of information. Svante Arrhenius in the 1800s told us that carbon dioxide was detrimental. The geologists at ExxonMobil said that if we didn't take action, we were going down. So the question is, what's the problem? So there's a bottleneck here, and that is that what we know consciously and what we actually do are two very different things. So I'm going to lay out a challenge that I did not intend to talk about or even present today. I had all of my notes and I was going to talk about them. What I'm going to say is that we need to take everything we've talked about here and bring it to the people who hold the keys to the kingdom but are not acting. Because we know right now today that the populace is already beginning to move away from discussion of climate, believe it or not, at least here in the United States. And I'm talking very, very specifically about the US because I can't possibly undertake the global. The issue is, and even within a certain political party, and I know we don't want to be political, there is now an attempt to do what's called climate shushing because it is believed that the populace doesn't want to hear it anymore. It's like going to your doctor and having your doctor say you need to lose weight, you need to stop smoking, drink less. Your financial advisors say you need to put more money away. We know we need to do these things. Here's the problem. As an activist, which is what I am, I have brought the psychological impacts, bringing children, young people with me. And when I have talked about the psychological mental health toll of what's happening to young people and propose solutions to people who are in local and state government, they have said to me, oh, we hadn't thought about the psychological aspects. We hadn't thought of those particular policies. The problem is that all our fancy talk, and I do say it's fancy talk, it's important. All of this research is important. It lays, in a sense, some of the groundwork. But the issue is turning what we know into what we do. Going to where we are, which is right here on climate tipping points. These are not something theoretical. We are already in the squall of climate tipping points. We have to go from climate tipping points to social tipping points. What can we do in the public square to make it known to policymakers the public wants change? Now, Niels Bohr, the famous physicist, said that change occurs, scientific beliefs change one funeral at a time. Yeah, young people get this better. And what young people want to see, and I've done surveys totaling 10,000 globally, 16,000 in the US, they want to see action by the government. And that's the number one issue. More than 8 out of 10 say they are worried or extremely worried. They want action from government. We need to be getting in front of those policymakers and saying all the things that we are saying to each other. That's the challenge. And I've already gone beyond my 4 minutes. Believe me, I have my 8 or 9 P's, all of them starting with P's, about the things that we can do. So this is hardly, it is but a thimbleful. But my message is taking what we know here, what we discuss here, bring it into language that state and local government, the federal government, we've tried, at the moment, it's not reachable, that they can hear and they can turn into policy and bring young people with you, because when young people speak, you can hear a pin drop. Thank you.
Thank you, Lisa, for the powerful and empowering words that reminds us what truly matters at the heart of this. This is the end of the first round of questions, so thank you so much to all of our wonderful panelists and for your insightful answers. We'll now launch into the second round, which will have 3 panelists. And this is just a small reminder that we have 4 minutes for each question. So our first question will be to Ms. Freckleton. In your executive role at UN Habitat, as the organization works to shape the next generation of resilient and inclusive cities, do you see climate mental health as a central pillar of the urban public health agenda? And if not, what would it take for UN Habitat and member states to formally embed mental health into the frameworks of urban planning and climate resilience?
Thank you so much, Colleen. And it really seems, coming after Lise to bring these points to the fore. And I always like to ground my interventions always with a real scenario and putting a face to what's happening. And I couldn't agree more with Lise that as young people, you need to be present in the spaces where these decisions are being taken, at the COPs, at the discussions here at the UN, in New York, maybe even at some of the conversations that are happening in Nairobi as we talk about, urbanization and bringing in some of those environmental related discussions. So bringing us back to a young person who is in a city that's displaced by flooding. They may be safe from immediate danger, but certainly they are going to face a couple of things: overcrowding, unemployment, uncertainty. Stress becomes chronic, and without support, that affects not only their mental health, but ability and capacity to learn, work, and contribute. Right? Now, for us at Habitat, while we do not deliver specifically on mental health services, but through our collaboration, as we heard from our colleague from the WHO earlier and other entities in the system, we work together to shape environments that determine mental health well-being in terms of housing or public space, disaster risk reduction, resilient infrastructure, and community systems. And our existing work already reflects this connection through the programs that we are developing around public spaces, the inclusion of nature-based solutions, and urban regeneration. This is how we are working with some of our local and regional authorities to develop cities that integrate these elements to improve both resilience and mental health. And just to say, as a quick example of an important political moment that's upon us, is this midterm, what you say about the midterm review of the new urban agenda. That is a conversation that is coming up in July. And this is back to back with conversations on the in-depth review of SDG 11 at the HLPF. So these are moments where certainly we want young people to be engaged. There is growing recognition that there is need for these integrated approaches across urban planning, health, and climate sectors, but there still remains instances where they're treated as separate issues, and we want to ensure that they're more embedded within resilience frameworks. So I will propose a couple of things. Visibility. How are we going to be working together to ensure that these mental health impacts are included in urban data, in climate risk assessments, and in resilience planning? In our design integration at the level of cities, how do countries and we work with cities to design these integrated approaches with the green spaces, with safe mobility, with accessible service and inclusive public spaces? Youth and community engagement. We recognize that the tools and the data are important, but they have to be integrated or complemented with direct engagement from the communities that are most affected. The global collaboration, and there is really a clear opportunity to deepen this agenda through the processes, including the upcoming IPCC special report on climate change and cities. So I urge you all to look out for that. And the moments here to work with member states to engender that political commitment. And two last points: financing matters, one, and two, what gets measured gets prioritized. So these are just some of my last reflections on how this can be advanced going forward.
Thank you so much, Ms. Freckleton, both for outlining the necessity of connecting mental health and brain health to urban policy and some strategies to achieve this, including the essential nature of including young people, including the communities most impacted. Ms. McCurdy, our next panelist, our second question to you is, you have dedicated your career to ensuring that children's environmental health science does not stay in the laboratory and that it reaches the decision makers who can act on it and can make policy, as other speakers have described. And as cities design the next generation of sustainable and resilient communities, which strategic approaches, interventions, planning tools, or policy mechanisms would be most effective to make children's mental health and brain health a non-negotiable essential pillar of urban climate resilience frameworks?
Thank you, Vildan, and thank you all the speakers. I really appreciate all of those really amazing comments. And I agree with you, all of you. And so I'll just, share my prepared remarks, which you will see is really in parallel with all the discussions we've had up to this point. Hopefully this will lead us to take the action we're all talking about. So we have concluded here and through other channels that the mounting evidence of climate change's disproportionate impact on children's physical and mental demands immediate coordinated action across multiple sectors, both at the national and local level. In order to activate cross-section partnerships, we need to first create the tools and resources that are appropriate for each of the stakeholders, including all age groups, by translating science into actionable messages and prevention strategies. Strong community connections are critically important. Educational materials developed in partnership with trusted community leaders who understand local values and priorities can reach diverse populations through culturally appropriate messaging. And building partnerships with community leaders and community organizations increases the local capacity needed for climate resilience. Through these established partnerships, communities can take action to implement adaptation and mitigation strategies in order to build sustainable and resilient communities and cities that address the need to protect children from the physical and mental impacts of climate change. But again, the very first step for structural systems change is evidence-based education tailored to the needs of each target group. One critical target group is the youth. Young people are well aware of the climate threat, which may lead to eco-anxiety if they do not have the tools to take control of the situation. We need to equip them with knowledge, tools, and skills in order to empower them to take action for climate solutions, which also would give them hope and contribute to their mental well-being. And youth action is fundamentally important. They hold enormous potential as advocates and leaders, as we see here with Vildan's leadership. We at APHA developed a climate and health youth education toolkit, which is posted on the Children's Environmental Health Committee's website, which I reposted, along with several resources for educators and communities. We also have tools for youth to maintain self-care. I encourage you to take a look and consider using these resources to educate the youth in your communities and also sharing this with others in your communities. The time for comprehensive action is now, and everybody has a role to play. Let's all work together to protect our children and our planet. Thank you.
Thank you so much, Ms. McCurdy, for your insights on how we can translate what we know and how climate change impacts children into tangible actions and policies. For our next question to Professor Ayari, we would like to ask, from an economics perspective, how do we make the financial case for investing in mental and brain health as urban infrastructure, not as a social welfare cost, but as a measurable driver of productivity, of resilience, and long-term economic stability? And what role can financing mechanisms play in scaling urban interventions that also benefit brain health? Thank you.
Thank you, Vildan, for this very important question. And this is exactly, actually, today I'm at the European Summit of Brain Economy in Brussels. And one of the key issues is to think how to make sure that brain capital, so the brain health, is fundamentally invested on not only as a cost or a social expenditure, but as a capital accumulation. So in fact, it becomes an investment and then it accumulates capital over time. And that is why I think to have the value proposition that without our brain health, we will see productivity going down. Also, we don't reach the labor market outcomes that we are investing in it, in fact. And then, of course, we see that our innovation capacity going down, and this all will impact negatively the long-term economic resilience. So this is why I'm saying this, because if we don't think that our brain capital is an investable asset, then with time we will see a clear decline of our economic prosperity. And this is what we need to start as economists and other disciplines measuring clearly and putting it in front of the policymakers, not only at a national level, but also at the global level to take the appropriate action. So in fact, poor mental health alone is already costing our global economies trillions. And today, the last number I heard, and which is an underestimated number, it's more than 3.9 trillion. And this is also does not take into account the potential loss in terms of productivity. And this, in fact, beyond the cost argument, it's really, in fact, what we need is to have clarity on how much we can earn if we invest $1 more in our brain health and brain capability, and at the same time connecting all the connectors. So one is climate. We know very well that climate degradation is impacting clearly our brain health, and we need to stop this. So of course, as an economist, and I've been very much contributing to the COP debates, we don't go anywhere with the COP debates. Every year we go a step backward rather than forward. And this is also a credibility issue because one needs to be aware that if there is no global action, of course, the investors and the financial organizations, they would go back to the old reference model, because we don't have the global, I would say, political will to move the situation of climate, dealing with climate forward. So in fact, as I mentioned, the interaction between loss of productivity or the gain of productivity if we do something is essential, because at the end, what we need is to have the capability to invest in brain health and embrace skills at the same time, and also on the enablers, all the disablers, because for the moment, pollution, climate, not dealing with the climate crisis, these are disablers to our brain health and brain capital. This is very clear. We have measured brain capital index. We have measured the enablers, which also serve as disablers, depending on the sign of the variable that we're using. And this also clearly, we see that the less we do on climate, to deal with climate crisis that we have, the more we lose in terms of brain capital. And this is the interaction between, again, brain health and brain skills. And this is why the trend of brain capital is going down globally, and particularly in certain countries where the action on not on brain health and of course on climate is not there. So for example, one of the countries, the United States, where the brain capital is declining, but not only, although a globe, the brain capital is declining. And this is really alarming for us, because at the end, if we see this type of clear measurement decline, it's very difficult to invest. But then we have to put the policies in place to invest further at the private and public spheres, not only on the public spheres, because we also need to open this to the private sector, because at the end of the day, I mean, climate shocks will be recurrent. This is not something that we will not see. We will see every once in a while. There is a big climate shock that everybody has to spend money in it, and nobody is preventing it. So we need to have actions in adaptation and mitigations together at the same time, and really putting the investment there. But then again, mental health and brain health is a parameter in which we need to take into consideration and invest in it, because it is also be part of adaptation going forward, because people have to be much more able to adapt to shocks as was the case before. And the role of the youth here is essential, not only in terms of advocacy, but also to change, to contribute to a system change. And this system change is not something that will come in one day. It will take years. But the problem is the frequency of climate shocks is going up. And then these events are not insured anymore. The cost of insurance is going up. And this will harm our stability and long-term stability. So this is why again, brain health investment today will certainly reduce the future health costs tomorrow, will reduce the inequality traps, and also the intergenerational vulnerability. And this is why how the question is how to finance this system change, and how to finance. It's very simple. We need to take all the investment, not only as private, as public, and also as individuals. And then obviously we connect this, because we have the connectors, we have the urban regions or the cities or anything else. And then we can develop these, what we call brain and climate positive instruments that work together and that will allow us to go much faster. Because in fact, if we are not fast, all these crises will be much faster than us. Thank you. And also one thing I wanted to add, of course, this is a debate that has been completely cut in the United States, the ESG, environment, social, and governance indicators. In Europe, these metrics are taken into consideration and they are regulated, means, you know, we need to include the environmental and governance and social indicators. Of course, my idea is to include mental health indicators in the S, in the social pillar, where all companies will have to report on those measures. So then we go even faster. This can happen in Europe, but unfortunately in other regions, this is not happening, and it's difficult to even track those progresses at the private sector. I will stop here, so any questions, it's welcome. Thank you.
Thank you so much, Professor Ayadi, for making the clear case on why we need to invest in brain health and mental health as assets in cities, and for how we can translate this into systemic change. So thank you to all of our distinguished panelists for round 2. I'd now like to open the floor to a few audience questions, and we ask our speakers to keep their responses to 90 seconds for each question. So anyone that would like to be unmuted to ask a question, please raise your hand on Zoom using the feature, and alternatively, you can write a question in the chat. Somebody just wrote in the chat, I think it was to me privately, but they ask, what concrete near-term action plan should be prioritized to re-energize engagement on these topics about mental health and brain health and the environment at the local and individual levels?
I'm sorry, will you repeat that question, Vilden? What?
Sure, and let me send it in the chat as well, to everyone. It's your speech, Dr. Van Susteren, and they say that the planetary health and climate agenda has not been sufficiently localized or made relevant at the individual level, and as a result, a lot of people haven't fully grasped this serious and potentially alarming topic. So going forward, maybe greater emphasis should be placed on engaging young individuals, and what concrete near-term action plan should be prioritized to re-energize engagement at the local and individual levels.
Well, this is the role of the activist, frankly. And so I'll condense this into 90 seconds, but part of the 8-page, the 8-point plan that I had, all starting with P's, has to do with what we do as activists, making sure that our lives speak for our values, and to recognize that the real change occurs when the people in power, policymakers, believe that the populace will not reelect them unless they reflect what the population is thinking. That means we got to be in the public square. We got to protest. Our lives have to speak for the values that we have. We bring the research to policymakers, but every one of us should be charging ourselves with becoming the voice of the people, because it is the voice of the people going to policymakers which convinces them they will lose their job, they will lose their power, and that is, after all, what a lot of people are driven by if they don't respond to what the populist is demanding. So obviously a very complicated issue, but we have to be living out these values very publicly.
Thank you so much, Dr. Van Susteren. Do any of our other audience members have a question? If not, we will move on to the closing remarks.
I just want to say that we know that sometimes change happens on a community or town level, right? You don't need to necessarily write to your congressperson to try to enact some type of huge policy change, but just going to your local town hall or council, a lot of people don't go, right? Or the people who do are, sorry, I didn't mean to give a thumbs up to myself.
Well, we agree with you though, Josh.
I just gave myself a lot of thumbs up. God. So basically, we know that a lot of people are not advocating on that micro level, and the people who do are the bad actors. So the people who may have other invested interests. So just going there and trying to make your case for your local park, or look to see what policies are happening within your town. That's a great first step as an individual.
Thank you so much, Dr. Wartzel and Ms. McCurdy.
Oh, thank you so much. I mean, I agree with both comments, and I want to add on to say the definition of activist does not mean necessarily we need to be on the streets protesting. And I think Joshua alluded to that. We all have a role to play. Like in the example of the educating the youth, we have the wonderful toolkit that we are asking for, public health professionals to go and offer it as volunteer to teach in their schools. But not everybody is equipped to do that. So what I'm saying is that you don't need to actually be the one in the classroom teaching this. All you need to do is make connections with others in your community who can actually take it to the next step. And also, we always talk about in public health, meet people where they are and bring them along. So we just need to find a way to connect with people, within their own space. And it was mentioned before, like health is a connector. You start the conversation about health. We don't go bang, bang on climate change, and we have to change the entire system. Start the conversation with everyone. Everybody has a role to play. So I want to emphasize that. And I'm sure Lisa, when she said activist, she meant activist in your own sphere, but then take it up, of course, to, to the decision makers through those various steps with appropriate language approach. And sometimes we need to be on the streets. Sure, why not? But again, I just want to emphasize that everybody has a role to play here. And again, there's good science, there are good resources and tools. So all we need to do as leaders in this field, try to engage people, where they are. So thank you very much.
Thank you so much, Leila, for broadening our definition of what it means to be an activist. In the sake of time, we're going to move to our closing remarks, but I just want to raise that there was a question in the chat on social tipping points and community level information infrastructure. So maybe if one of our panelists wants to try to answer that in the chat, we really appreciate that. And for our closing remarks, I'm delighted to invite the Honorable Ambassador Hamad Sayar to deliver the remarks for this session. Ambassador Sayar is a seasoned career diplomat representing the Kingdom of Bahrain, with decades of service across some of the world's most important multilateral and bilateral stages. He is currently the Deputy Permanent Observer of the Cooperation Council for the Arab States of the Gulf. Over the course of his career, Ambassador Sayar has served as Director of International Organizations within the Bahraini Ministry of Foreign Affairs, where he guided the kingdom's engagement with global institutions and multilateral frameworks. His extensive overseas assignments have included postings as Counselor of Deputy Chief of Mission in France, the UK, Turkey, and the US. We look forward to your remarks.
Hello, hi, good morning again. I don't know if my voice is clear. Okay, thank you very much. Good morning, and thank you again for conducting this event. Allow me to share the point of view of not only GCC countries, but maybe more of an official and more political point of view here. Well, thank you for conducting this event again. Well, as you may know, well, the world is focused on conflicts nowadays, especially with events in the Middle East and the closure of Strait of Hormuz, which have deeply threatened global stability and severely disrupt the free flow of energy and sustain worldwide economies. As the UN Secretary General just warned recently in his media statement regarding this crisis in particular, we're facing a catastrophic scenario by this year's end, a severe global recession, inflation exceeding 6%, and the global economic growth reducing to 2%. If unresolved, this disruption to the global economic may threaten to push 32 million people towards poverty and leave 45 million people facing severe hunger. These immense economic pressures will certainly interfere in our collective capacity to finance and achieve the sustainable development goals in the future. But alongside these severe geopolitical threats, there is a deeper crisis unfolding quietly, which is affecting human minds and their mental health. As mentioned by your distinguished panelists, the air pollution is responsible for nearly 7 million premature deaths a year, which is under SDG 3. This is could not be called but a failure to achieve the SDG, unfortunately, on global scale. From the GCC perspective, well, the states has recognized that physical and mental health cannot be dissociated from environmental resilience. That's why across the Gulf states, these policies has been integrated, and mental and environmental care strategies has been implemented. For example, Bahrain, I come from Bahrain, that's why maybe I'm taking it as an example, but we have a health strategy plan, or national health plan, by working closely with the WHO to actively reduce the healthcare inequalities and scaling up universal health coverage. especially addressing mental health vulnerabilities and non-contagious diseases that are worsened by environmental stressors. Also, we have, maybe you have heard of the Saudi Green Initiative or the Green Middle East Initiative, which is fundamentally transforming our environmental landscape with an ambitious $187 billion investment aimed to cutting carbon emissions by enhancing air quality and expanding green cover. We are directly investing in the mental and psychological well-being of our populations to mitigate the environmental stressors and to cut eco-anxiety and mental decline. As mentioned also by your distinguished panelists, the World Urban Forum in Baku is coming closer, and the SDG 11 is important in increasing the city's inclusivity, safe, resilience, and sustainability. So the midterm agenda is an important topic at the World Urban Forum that we will all focus on. Under the G77 and China, we have submitted several amendments, which we are hoping to help and to demonstrate that urban design as a direct intervention for mental health. Many states in the GCC also are heavily investing in sustainable smart cities. For example, in Qatar, we have the transit-oriented development, or TOD, which is helping into massive infrastructure projects. Also in Dubai, we have the 2040 Urban Master Plan, represents 1 billion commitment to doubling green and recreational spaces, proving that urban design can actively promote mental health and community resilience. So, in conclusion, the Arab Gulf states are committed to Vision 2030 and beyond. Visions of thriving knowledge-based and based economics. And as well as we all know, you cannot have a knowledge economy without protecting the organ of knowledge. So our task now is not to deepen the damage, but to heal the planet so it may continue to heal us. Thank you again for your time, and thank you for this event.
Thank you so much, Honorable Ambassador, for summarizing the event, summarizing the important topics that we've discussed here today, and for summarizing the commitment of Bahrain and the other Gulf countries as well. And I would now like to invite Dr. Van Susteren, our co-host, for our closing scientific reflection, which will wrap up our events.
Oh my goodness. All right. I thought I was not going to be asked to do that in the end, but I'm very happy to say that this is a very impressive panel, obviously, and that health issues becoming a mental health. Oh, I do need to ask you, how much time do I have, Vilden?
2 or 3 minutes would be amazing.
Okay. All right. So health issues, this is what's underscored, and are not only becoming preeminent in our minds, but the mental health toll of what we are seeing, particularly in children or young people, because of course, young people are at the tip of the spear. They will experience the cumulative effect. And this has been underscored again and again, as well as the fragility, the vulnerability of young people from a physical perspective, not just a psychological one, but a physical perspective. We heard about how their brains are exposed to climate stressors and how this makes them more prone to acting out in ways that are obviously problematic for their health. So one really impressive, I think, statement among the very many that were made is how critical urban designers are in doing this work, because it is really reestablishing our relationship to nature. Yes, we like technology, we appreciate technology and all the rest, but it is resulting in a decline in our interactions with each other. And in the argument for community centers, for community action, for parks and all the rest, it is understood that our capital is our human interconnections, and taking those connections and demanding locally and wherever we are that our policymakers listen and write the policies that are the infrastructure for long-standing rewards or the financing to be able to create this. So it was a wonderful, I think, overview of all of the elements, from the physical to the mental, to the solutions that we can look at, to the significance of how we are harming ourselves, and what we can do to forestall that at a time when time is running out. So I hope that it just begins to cover it. I'm often accused of just saying the things that especially appealed to me. I hope that I recognized everyone in many ways, because I know we all agree fundamentally. Thank you very much, Vilden, and of course, Colleen and fellow panelists and attendees.
Thank you so much, Lise, for wrapping us up and for the reflections on everything that we've all enjoyed in this panel. And thank you to all of our distinguished speakers, to Dr. Joshua Wurtzel, to Dr. Maria Nera, to Ms. Tony Shea-Freckleton, to Ms. Layla McCurdy, to Professor Riyam Ayadi, to Dr. Lisa Van Susteren, and to His Excellency Ambassador Hamad Sayed.
Thank you so much, everyone. Like Colleen said, we would also like to acknowledge our co-organizers, Lisa Van Susteren from the Climate Psychiatry Alliance and Dr. Joshua Wurtzel from Yale University, as well as Youth for Planetary Health. And we warmly invite continued connection and collaboration from our participants. Thank you so much once more to all of our wonderful panelists and speakers, and to all of our audience members for their participation.